Is robotic prostate surgery really better than traditional open surgery, or just a fancy gadget? This is one of the most common questions men ask me after being diagnosed with prostate cancer. Today, I'll explain what surgical options exist, how robotic surgery compares with open prostatectomy, when we remove lymph nodes, and what complications and care you should expect, all backed by research. By episode end, you'll know which offers faster recovery and fewer complications. But first, what exactly is radical prostatectomy? Radical prostatectomy removes the entire prostate gland and nearby tissues. It's the gold standard for localized cancer in fit patients with 10-year life expectancy. But how it's done matters. Open surgery, big incision, versus minimally invasive, robotic, laparoscopic. There are three main ways to perform prostate removal. Open prostatectomy. Large incision, longer hospital stay, more blood loss, slower recovery. Laparoscopic prostatectomy. Small keyhole cuts, limited instrument flexibility. Robotic radical prostatectomy. Da Vinci robot. 3D magnified vision, wristed robotic instrument, greater precision, less blood loss, better continence and sexual function recovery, backed by multiple surgical centers. Research shows robotic radical prostatectomy (RARP) beats open in key areas. Blood loss. Robotic is 250 ml versus open is about 720 ml, 3 times less. Hospital stay. Robotic is equal to 1 to 2 days versus open is equal to 7 to 10 days. Complications. Robotic is equal to 11% versus open is equal to 17% major issues. In most modern centers, robotic prostatectomy is preferred because of its accuracy and faster recovery. So when do we remove lymph nodes during surgery? Lymph node removal, called pelvic lymph node dissection, is essential when the cancer has a higher chance of spreading. NCCN recommends PLND for unfavorable intermediate risk, high risk, very high risk prostate cancer. In certain advanced cases, we may also remove nearby involved structures such as parts of the bladder neck if the tumor is extending outside the prostate. Studies show PLND helps in accurate staging, guides treatment decisions, and may help improve survival in high-risk disease. But what about complications? What should you really expect? Risks for both methods include urinary incontinence at 10 to 20%, erectile dysfunction ranging from 30 to 70%, and infection at 5%. Robotic procedures tend to lower the risk of infection and bleeding. To prevent complications, surgeons use nerve-sparing techniques, ensure experience with over 100 cases, and recommend pre-operative pelvic floor exercises. Pre-op. Stop blood thinners 7 days prior, bowel preparation, antibiotics, fitness optimization. Post-op. Keep the catheter 1 to 2 weeks, Kegels daily, walk early, PSA check at 6 weeks, 3, 6 and 12 months. Watch for fever, hematuria. So, is robotic better? Yes. For faster recovery, less blood and pain, open suits complex cases. Choice is based on the surgeon's expertise. Thank you for watching. Next episode on the radiation therapy. Does it beat surgery? Watch it to know more.